Good morning. It's the day before Halloween. This is October 30th, and I'm talking to you from the Back and Neck Pain Relief Center. I'm Dr. Joe Schneider, and I've been here for about 25 years treating patients in the Delaware County area, and we have been so successful. I'm so excited about the work that we do. I'm so excited. I received an award at the last conference for functional neurology and rehabilitation for clinical excellence, and I'm really proud of that. I'm proud of the association, and I'm proud of everyone that's been involved with it. But today, I came in and Mr. Bones has a headache, okay? So one of the things that I find in patients when they have headaches is they have temporomandibular joint disorders, okay? And the temporomandibular joint is actually the jaw joint right here, okay? It's what we move our lower jaw or the mandible on that connects to the cranium. And we have four muscles that are associated with that temporomandibular joint, and muscles of what we call mastication, because we use that to chew, okay? But when people are stressed out and they take that stress home and they don't sleep well, they usually clench and grind their teeth, okay? Now, when I palpate or touch those muscles, the muscle out here is called the masseter. There's another muscle that comes up under this bone here and up onto the cranium called the temporalis muscle. And then inside the mouth we have two deep muscles. One's called the medial pterygoid and the other one's called the lateral pterygoid. Now, why is that important to you when you have a headache and if you have temporomandibular joint disorders? Well, those muscles are important because when they go into spasm and they have trigger areas within the muscle that are causing spasms, then that muscle can refer pain up into the head. It can also cause issues with the upper part of your neck. It's a very common disorder. I've been treating it for years and years on hundreds of patients. And the way we do that is we look at the upper part of the neck, we align those bones if necessary or move them, and then we also move the jaw and we treat the muscles that are associated with that. Most of the time patients also have issues with balance, with eye movements, with hearing and so forth. So we have to assess their neurology, and we have to start to give them exercises that will permit them to relax and not clench at night. The other thing that we see with patients with temporomandibular disorder is that their muscles of the diaphragm for breathing aren't functioning properly either. So I ask a patient to take a deep breath, and they'll take a deep breath only through the muscles of the ribs. They try to expand the rib cage to get more air in, rather than opening up the rib cage with the diaphragm. So the diaphragm is the bellows, and then when you pull it down, it sucks air into your lungs, and then you don't have to move your ribs. And when the diaphragm contracts up, it blows the air out of your lungs. It's a full breath. It's a greater volume of air that you get in, and it's not a stressful breath. So a lot of patients with temporomandibular joint disorder and some neurological issues that are going on with their eyes, their ears, and movement will have different areas of breathing that's off and different areas of sleep coupled with clenching of teeth. So if you have someone that's suffering every day with headaches, and headaches is one of the #1 things that interfere with a person's life and their work, then refer them into our center, the Back and Neck Pain Relief Center at 610-544-9800, and have them get a comprehensive examination so that we can see if these things are present and we can work to get rid of them together. Thank you and have a great day.